Start. Our lecture will be very short. This introduction to pathophysiology and general nosology. Introduction to pathophysiology and general nosology. Yes. First of all, I will tell you short history about pathanatomy and pathophysiology. In the past, pathanatomy and pathophysiology was combined in one subject. It's called as pathology, general pathology. And then it divided into pathanatomy and pathophysiology. Understood? What is pathanatomy? How it was discovered, this subject, pathanatomy, not pathophysiology, now pathanatomy. In the past, patients were dying from diseases. And doctors become interested. What is the cause of death? Cause of death. And how organs and tissues become changed in structure after death. How to see this? They develop the method autopsy. They open the died patient and remove the organ which was sick. And we have already normal organ, and we doing conversation, yes, between organs. This sick organ died. And we see the structural change. Then I take tissue, under microscope, I see intracellular changed also. This subject was called bath anatomy. Understood? So the bath anatomy studying what? Structural change in organs and tissues due to disease after death. Understood? Organs, we call it macro preparation. Tissue, we call it micro preparation. Means macro by eyes, micro under microscope. I already explained pathanatomy. Then what is pathophysiology? Doctors become interested what happening inside our body during disease before death. Before death. What happening inside body while he's still alive before death. Now tell me please, how to see this? How to see the mechanisms inside our body and the patient still alive and disease is developing and he haven't died yet. How to see this? Can I do autopsy? Biopsy in the past? No biopsy. No, it was little methods, not developed medicine. How to see this? Can I study the disease in the patient till death? I mean, can I keep the patient with disease till complication, till death? No, because this is a human. I have to treat. It will be anti-humanity, this one. Understood? Then how can I study disease in sick organ, in sick organism? I can create this disease in animal. Understood? Then I can study this disease in animal. This is the main method of experiment in pathophysiology, to do the model of disease, of human disease on animal. Understood? Understood? Nice. So, pathophysiology, what does pathophysiology studying? Pathophysiology is studying the mechanisms of development of disease in the body. Or other words, pathophysiology is studying the functions of sick organ or the functions of organs of sick body. Normal physiology was studying what? The normal functions of normal organism. The pathophysiology is studying the functions of organs of sick organism. Now I already give you definition about anatomy, structural changing, and pathophysiology, mechanisms of developing of disease. Understood? How to create disease on animal? There is multiple methods. For example, I want to create diabetes, you know, yes? It's insulin insufficiency. What I have to do? I can surgically remove pancreas from animal. Then they will develop diabetes. I want to study liver failure. I remove liver. I want to study pneumonia. I give microbe of pneumonia and inhale or enter this microbe into animal, and so on. Then pathophysiologists studied all diseases in animal. Which advantages of experiment in pathophysiology? Which advantages? First one, I can study full picture of disease from beginning till outcome. What can I do in human? Understood? Next advantage, I can decide the cause of disease. For example, diabetes. I removed pancreas, it's become diabetes. Yes, it means insulin insufficiency lead to diabetes. For example. Next advantage, while I can create disease, so I can create what? Medicine. While I can do disease, so I can what? I can search for medicine. We call this experimental therapy. And last one, among multiple disease, what I do in animals, I can find which disease I can treat and which disease cannot treat. Treatable diseases and non-treatable disease. This multiple advantages of experiment in pathophysiology. Understood yet? But we have some minuses. Not all human disease I can do model in animals. I cannot study all human diseases on animals. For example, psychological diseases I cannot study. Sure. For example, schizophrenia. Can I study on animal? No. Hallucination. Cannot. Understood? Due to what? Due to structural changing between structural difference between animals and human. They have, we have already developed organism. They have none developed. وهكذا. Understood yet? Understood yet? This it was introduction to pathophysiology. Now, next lecture is general nosology. Very short. Yes, I know. Very short. What is nosology mean? Nosos, disease. Logos or logi, studying. Studying of disease. From today, you will understand what does disease mean. Repeat again. From today, you will understand what does disease mean. What does disease mean? Before giving definition of disease, I have to give definition of what? Of health. What is health? What is health? Yes, what is health? The health is the condition of fully mental, physical, psychological well-being. Not only absence of defect. Understood? So absence of defect doesn't mean fully health. It could be mental, psychological, and so on. Well-being. So what is disease? Disease is a new condition of our body. New condition of our body. It's developed due to entering of causative factor to our body, harmful causative factor or pathogenic causative factor, which lead to inhibition of adaptive mechanisms of our body against atmospheric conditions. I will repeat again. What does disease mean? Disease mean new condition of our body due to entering or affecting of pathogenic causative factor leads to inhibition of adaptive and compensatory mechanisms of our body against atmospheric conditions. Understood? This is disease. Now look please, very, very quickly, very fast. In sick patient, we can find one or more of three pathologies. In sick patient, we find one or more of three pathologies. First one, pathological reaction. You remember from physiology that normal reaction, it's normal reflexes. For example, pupil against pupil to light. Pupil to light, how it's react? Contracted. In sick patient, we can find dilation to light, pupil to light dilation. Is it normal or not? It's pathological reaction. So pathological reaction is abnormal reaction of our body to our conditions, two conditions. Or other example, vessels, our vessels, skin vessels, they contracted to the cold. If they dilated to the cold, so this is pathological reaction. Understood? If we find one of these reactions or other reaction, we can think about that this patient is sick. Understood? Next pathology we can find in sick patient is pathological process. Must be for any disease, could be the basic is pathological process, basic point. Examples for pathological processes: inflammation is pathological process, allergy, tumor, metabolism disorders. All what we will study in this semester is pathological processes. Understood? I mean, other word, this patient came to me. He has, for example, here he has redness, swelling in the arm. I will think it could be inflammation. Yes, it could be allergy. It could be tumor. This is all are pathological processes. Understood? Third pathology is pathological state. Pathological state. Pathological state means is a structural defect in the body, and it's still in the body till death. For example, blindness, lost arm, amputated leg, scars after operation. This we call pathological state. So repeat again, please. In any sick patient, we find one or more of three pathologies: pathological reaction, pathological process, pathological state. Next point in our lecture is classification of diseases. How we can classify diseases? According to cause, they are classified into hereditary and acquired. Yes? Hereditary, if you remember from biology, and they said that hereditary disease could be genetic, chromosomal, yes? It could be congenital defects. This all we call hereditary. What does hereditary mean at all? It means the pathology with which the baby is delivered already. He delivered already with hereditary defect. Understood? And occur means during the life. It could be infectious, non-infectious. This first classification of disease, according to what? To cause, hereditary and acquired. Next classification of disease, according to mechanism of developing. What is the main process? So disease is divided into inflammatory, allergic, neoplasia, metabolic, neuroregulation disorders. Understood? This is according to what? To mechanism. Other classification, please. Other classification of disease. We can divide disease according to what? To age. Yes? Age of patient. Neonatology diseases. Neonatology after delivery. Understood? Then pediatric. Then adult. Then geriatric. Geriatric means after 60 years. According to what? To gender. Male and female diseases. Are they diseases in male are different from female? Yes. Are they purely female diseases and cannot be in male? Yes. For example, uterus diseases. Do we have uterus? Female organs. Ovarian inflammation, for example, or ovarian polycystic. For example, do we have male? No. Do female have prostatitis? No, because they have no organ. That's why male and female. So I said about classification according to cause, according to mechanism, to age, to gender, and also we can divide according to system. Which system of disease? For example, cardiovascular diseases, respiratory, digestive, وهكذا. Hormonal. This is classification of disease. Understood? Now look, please. What is the criteria of diseases? Criteria of diseases. 3 criteria. I mean, other words, what I have to find in the patient to decide that he is sick. There are 3 criteria. 3 criteria. Symptoms. There are 2 types of symptoms: subjective and objective. Understood? And it's visible that he is weak. He is weak. He cannot walk. For example, he cannot walk. So symptoms could be objective and subjective. What is the difference? So objective symptoms and subjective symptoms. Objective symptoms is what the doctor or the people can see in the patient. Skin rashes, anything, what we can see. This is objective symptoms. And what is subjective symptoms? What is the patient say? He's saying, I feel pain, I feel like this. Understood? Subjective symptoms, objective symptoms, and inhibition of adaptive mechanisms. This is 3 criteria of diseases. Understood? Now tell me, please, fever, objective or subjective symptom? Fever. Can we see fever? No. Subject, he will tell. But if I measure fever by thermometer and I see, for example, 38, so then objective. Headache, objective or subjective? Subject. He say. Yes, he says. Next point in our lecture is the stages of diseases. Stages of disease. How many stages of the disease? 3. Very nice. Beginning, main disease, and outcome. Any disease, whatever this disease, is it acute, acutist? Yes, I forget something, so sorry. According to classification of disease, we also classify disease according to duration. Acutist, acute, subacute, and chronic. Acutist, till 4 days. The disease developed. Acute from 4 till 15 days. Subacute 15 days till 40 days. Chronic, months, years. Understood? So look, please. Whatever the disease, acutist, acute, subacute, 3 stages. Beginning, main disease, outcome. The beginning, we also divide it into 2 stages. Pre-disease and prodromal period. Pre-disease and prodromal period. What is pre-disease? From the name, is the period before disease, yes? Now look, please. Pre-disease is the period when started with the causative factor enter to our body till when at least one symptom is appear. So tell me, please, pre-disease, this period is symptomatic or non-symptomatic? Non-symptomatic. Understood? What happening in this period? Our adaptive mechanisms start to work and to protect our body. Understood yet? What is prodromal period? Prodromal period is the period when the non-specific symptoms appear. Non-specific symptoms appear. It means that we have in general non-specific symptoms and specific symptoms. What is the difference between non-specific symptoms and specific symptoms? Non-specific symptoms means the symptoms which can be appear in different diseases. And we cannot put correct diagnosis because this is general symptoms. For example, fever, headache, dizziness, weakness. This is general symptoms, non-specific. When we have these symptoms, we call this period prodromal. Next, repeat again, 3 periods of disease. Beginning, main disease, outcome. Beginning, I said, this is pre-disease and prodromal period. Pre-disease, non-symptomatic, prodromal, non-specific symptoms. Main disease, when at least one specific symptom appear. Specific symptom appear. What is specific symptoms means? The symptoms is especially just for this disease. Then I can put correct diagnosis. Understood? Yes, you said correct about vomiting. You said vomiting. Vomiting could be general symptom because who has gastritis, he has vomiting. In some rare cases of myocardial infarction, also vomiting. Head trauma can give vomiting also. But then clinicists, doctors, they can differentiate between vomitings. For example, if I, after meal, directly, projectile vomiting, so I can think about gastritis. Understood? In other case, if he has heart attack, to left arm, left shoulder pain, and dyspnea, and then vomiting, this is a non-specific symptom for myocardial infarction. But in gastritis, it's specific symptom. Can you imagine? Last stage of disease is outcome. How do you think, which variables of outcomes of disease? How the disease can be ending? I mean, the disease ending with what? 5 variables of ending of disease. Can you imagine? First one, recovering. Yes, recovering means become health, no disease. Next, become chronic. Disease could become chronic. Third, recurrence. Fourth, complication. Disease become more difficult. And fifth, death. Repeat again. 5 outcomes of disease: recovering, health, chronic, recurrence, complication, and death. Health could be, first one, health could be complete, incomplete. Complete health and incomplete health in both, or symptoms and signs of disease are disappear. No. But what is the difference? In incomplete health, there is one pathological state still in our body. For example, blindness, deafness, scar, amputated arm, leg. For example, he has gangrene. You know gangrene? The patient has gangrene. Do you know gangrene or not? Death tissue, for example, in leg, it's usually in diabetes. Leg become black, died. What we have to do to treat? What we have to do? To amputate, remove leg. He become health, but complete or incomplete? Because he lost leg, this incomplete health. Understood? Complete health means for recovering and no pathological state. Incomplete for recovering, but pathological state still. After operation, for example, scar, still. Understood? This health. What about chronic? When the disease become chronic, what is it? It means that disease still, yes, but it has 2 periods: remission and recurrence. Remission and recurrence. Remission when no symptoms. Recurrence, in some cases, it's developed. The symptoms will become. Third one, we said recurrence. Third one is recurrence. Recurrence means it's not chronic, it's other. Recurrence means when the disease disappear at all, but after sometimes it's recurrence again. Due to what? Due to might be predisposing of the organism. He is predisposed for this disease. Understood? It means that this disease likes him. Complication. What does complication mean? Complication when the disease become more serious or more difficult. For example, I said already, diabetes, the complication of diabetes is gangrene, for example. Ischemic heart disease, complication myocardial infarction, like this. Well, last one is death. 5 outcomes of disease is, last one is death. Remember please that anybody, according humanity, I think, we are dying from up till down. Can you imagine? Can you imagine? How we are dying from up till down. Whatever the cause of death, whatever the gunshot or bleeding or anything, from up till down. First dying cortex of brain, cortex. Then subcortical structures. Then medulla, then heart to lungs. We are dying from up till down. So scientists give for us 5 stages of death. Which 5 stages of death? Tell please. Pre-agonia stage. Pre-agonia. Terminal pause. Agonia. Clinical death. Biological death. Biological death. Pre-agonia. Terminal pause, agonia, clinical death, biological death. What is the other? What is pre-agonia? Pre-agonia when our all functions are become decreased, except respiration. The patient become breathe fast. Tachypnea, breathe fast. When he breathe fast, he lose CO2. Understood? CO2 become low in our body. What we need to increase CO2. Stop breathe. This is second stage. Terminal pause. Understood? Then agonia. What does agonia mean? The word agonia. Agonia means surviving. We try to our body is trying to survive itself from death. What he trying to do? He trying to increase all functions. Increase blood pressure, pulse, sugar level, kullu increase. Understood? Yes. But, so sorry, in agonia, the cortex is switched off. Cortex. Subcortical just working. How long, how far they can work without cortex? How long subcortical structure can work without cortex? Not long time. Because they should have control from other, but no. Then our functions become decreased again. Till 4th stage, clinical death. What does clinical death mean? Clinical death. No heartbeat, no respiration, no pulse. All our life-threatening functions are stopped. Except brain still alive. Brain. Understood? Is still alive. He haven't died yet. How many, tell me please. Yes, tell me please. How many times or how many minutes the brain can still alive without oxygen? 5-6 minutes maximum. And he's still alive due to or thanks to anaerobic respiration. Anaerobic respiration. 5-6 minutes. In these 5-6 minutes, we have to try to what? To CPR. Yes. If we successfully do, he will return back to life. If not, he will go to 5th stage. Biological death. Biological death is irreversible stage. First 4 stages are reversible. Fifth stage, irreversible. Biological death. Biological death means this is the stage of death irreversible, and when the three features of death appear on the body. Features. Which features of death we can find on the body? Features of death. The body become hot or cold? Cold. And we will find some skin rashes like blue, due to accumulation of desoxyhemoglobin, and muscles become tension because of accumulation of calcium inside muscle, become tension. That's why after CPR, if he become alive, could be developed some damage in the brain after CPR if he become alive. Due to what? Due to hypoxia, because he has hypoxia, and also due to hyperoxia, a lot of oxygen. He inspire a lot of oxygen. Some of oxygen cannot be used. It's become poison materials. We call them free radicals. Free radicals of oxygen. They causing اللي هو cell membrane damage. For example, O1, O point, OH, hydroxyl group, and H2O2. These free radicals. Understood? It was today lecture, first lecture of pathophysiology, introduction and general nosology. And thank you very much for your attention.